Well, I'd love to believe it's realistic, Jonathan, but to be quite frank about it, I really don't see how the state can possibly afford this. I mean, what we're effectively talking about here is there's no such thing as free GP care. Somebody has to pay for it. You either pay for it out of your taxes or you pay for it out of your pocket directly, which is what private patients are doing at the moment. So what this appears to be is giving everyone in the state a medical card, because that's 40% of the population has at the moment. So if you want to call that free GP care for the entire population, the medical card system in Ireland, the GM medical card system, costs in the region of 400 million a year to operate for that 40% of the population. So if you want to extend it to the coverage of the entire population, I suppose you're looking at over $1 billion.
Well, hang on a second. I'll just give you the exact figure that was quoted by the Minister. She's saying free GP care for all by 2015 is going to cost about €300 million based on the current value that's placed on private GP fees.
Yeah, that doesn't really sound that realistic when you consider, as I say, it's costing 400 million just to cover 40% of the population. The other thing about this that strikes me, though, is it's unrealistic for a number of reasons. Okay, we'll not get into the cost too much, because let's take our word for that one. But there's a manpower crisis in GP. We have 2,600 roughly GPs in Ireland at the moment. We need to have roughly 4,000 in this country, and we're not training enough GPs. So if you have a situation where everyone in the state has free GP care, the level of demand on GP services in the state will increase massively. Because you see, people often forget this. In this country, you have 90% of patients will get an appointment with their GP within 24 hours. And we take that for granted in Ireland. In the NHS, in many parts of Britain and Northern Ireland, where it's completely free for all, what happens is you can wait up to 5 to 7 days for an appointment. And the reason for that is obviously you're not paying for it, so the level of demand is much higher. So if you have a situation whereby everybody in the state can get a GP appointment immediately, or wants one immediately, people are going to end up waiting unless you massively increase the number of GPs, which is simply not going to happen because we're not training enough GPs. So I really can't see how it's going to work without creating a massive backlog in the system.
Well, we have a couple of years now, to be fair. I mean, what she's talking about is developing these primary care centres. Now, a lot of GPs, to their credit, have taken this upon themselves, whereby they employ a nurse in their practice. They'd bring in a couple of GPs, so if they're not there, there is always a doctor on hand. So, all of this sounds very good, and trust me, as a parent of 2 young kids, the idea of not having to pay to the GP every time we have to go is a great one. So are the doctors going to get on board with this, despite the concerns you have?
No, to be honest with you, I'd be happy to get on board with it. But, I mean, I have no problem with the idea of having universal health care for everyone. I really don't. What I'm afraid of is that the government is going to try and introduce this without paying for it at all, by basically expecting the doctors to see all these patients effectively for free. In other words, let's get them to see everyone and just not pay them. And you see, as you pointed out there, doctors are running these primary care centres. They're employing nurses, they're employing secretaries out of their own pockets, I might add, which is a good thing, and I don't have a problem with that. But just to go back to your point there, you mentioned about, being a parent of children and so on. Just think about this scenario. If you're a private patient and you've got a child and wakes up at 4 a.m. with a sore ear, what you're going to do as a private patient is, look, if I bring this child in the morning to the GP, I'm going to end up paying €50. Why don't I give the baby a bit of Calpol for a few days, see if it settles down. Then in 3 or 4 days, I'll go to the GP if the child's not getting better. And that's exactly the right thing to do, because 70% of the time it'll be a viral infection and there was nothing more to be done. The trouble is, in a situation in Ireland where if you didn't have to pay anything, there is no barrier to you just saying, we'll go down in the morning anyway. And unfortunately, in this country, that's what tends to happen. We have a situation whereby if you don't have any financial disincentive to going, the system invariably tends to be a little bit abused. And as a result, the demand on GP services increase. GPs engage through pressure in what can only be described as inappropriate prescribing of antibiotics, That happens, unfortunately. And society suffers as a result. So there has to be a realization here that if we're going to have free healthcare for all, we have to first of all cost it. Then we have to have sufficient doctors to actually do it, and then we have to realise that it has to be enforced in some kind of way that it doesn't turn into chaos, which I think is a very real possibility.
Yeah, you don't have much faith in the Irish population of being able to restrain themselves. How come they can do it in Britain?
Well, that's what I'm saying. In Britain, you can wait up to a week for a GP appointment. So
even if you have a screaming child in your arms?
Look, to be fair, I don't want to be slagging off people here. The truth is most people are sensible, most people are pragmatic. But the truth also is that there will always be a section of people, if something is completely universally free, that there will be a certain amount of abuse will creep into the system. And It's a fact. And I'll give you a good example. Do you remember the prescription charge that was introduced 2 years ago
the 50
for
cent
medications?
Yeah.
50 cent per item. Do you remember that?
Yes.
Yeah. Well, here's what happened. Everybody said, oh, this is retrograde, this is nasty, this is horrible, this is a socially deprived people will be hurt, and so on. It's actually turned out to be an unqualified success. Because what they discovered was people were, because they didn't have to pay anything for the medication, a proportion of people were ordering medication every month off the GP, collecting it in the chemist that they did not need, that they were not using, but they were asking for it every single month out of sheer habit. So then what happened was, when they were actually asked to pay 50 cents per item, they suddenly looked in the medicine cupboard, saw all these tablets they weren't taking or creams they weren't using, and they gave them back. And they said, well, actually, no, because now I'd have to pay 50 cents to go. So what you had is a situation where not only did that measure raise a huge amount of revenue for the state in the 50 cents per item, it also probably saved the state tens of millions in medications that were effectively being wasted. Yeah. And what's very interesting is James Riley, when this reform was introduced, was cribbing about it, saying it was terrible and he's just going to abolish it when he got into power. You'll notice now he stopped talking about abolishing it because he's seeing that it's actually working.
They're not abolishing a lot of revenue streams, to be fair, Rory. So would it be better that they, like, I know by 2014 they're talking about subsidised GP care, but should that be what they're looking at as opposed to total free GP care?
Yeah, I think that's more realistic. Well, the way I would look at it is, I think if you're going to have free or universally health insurance or whatever means they're going to do this, I certainly believe that people should be entitled to a certain number of free visits to their GP straight away. So the way I would do it if I was in charge of it, I'd say, well, look, you can have X number of free visits to your GP every year, fair enough. And after that, a small nominal payment. Just to discourage, overuse of the system. I mean, if you ask any GP in the country, they'll tell you that they have a small number of patients in the practice who, unfortunately, do overuse the service.
They're called the heart sinks patients, aren't they?
Well, that's a phrase that's occasionally used there. Yeah, that is true.
Just to explain to listeners what that means, when you see them coming through the door, your heart sinks.
It's actually a phrase that was invented by an Irish GP about 25 years ago, and he talked about that a certain patient, when they walk in the door, his heart sank because they were there all the time. But I mean, look, we don't want to get into this patient bashing thing. The fact of the matter is, the vast majority of people are sensible. The vast majority of people use their doctors appropriately. But if you're going to give free care to everybody, you have to have some kind of safeguards in place. The other thing about it is, I mean, there's a kind of a myth out there that the GPs are just all greedy and trying to, shaft the patient and trying to take money off them and so on. I would think the vast majority of GPs would love nothing more than to see some kind of universal health system like this created, because, to be honest, I don't like the idea of chasing people for money, but at the same time, GPs have got to pay their staff, they've got to pay their overheads, they've got to pay their taxes same as everybody else, they've got to pay their heating, their lighting, their rent and all those kind of things. So it is a business-based model we operate in Ireland. And if we're going to move from that to a state model, a la the NHS, well, then it has to be properly resourced. So the most important point for me in this is really the manpower crisis in GP. And to go back to that again, we're talking about a situation where about 25% of GPs in Ireland right now are within 5 years of their retirement age. And we already have a manpower crisis. And we have the great unmentionable of Irish general practice, which is that at the moment, 75 to 80% of graduating GPs in this country are female. Now, that might not sound like a big problem, and it certainly isn't, except for the fact that these young women are less likely to work full-time for the rest of their lives for obvious reasons. So therefore, you have this situation where that's been ignored, the feminisation is being ignored, and yet at the same time we're expecting GPs to suddenly massively increase their workload across Ireland. I don't see it as very realistic, to be honest.
OK, Roy, just before I let you go, you have been on the programme before criticising the HSE and its structure. Yesterday we had major reforms announced for the public sector. The HSE, we would assume, is going to be particularly targeted, given the amount of inefficiencies there are, not at the front line, but those slightly behind the front line. Would you have confidence that Minister Brendan Howlin will achieve what he wants within that particular organisation?
Well, I doubt it, to be honest. I mean, if there's one organisation in the state that's shown itself incapable of change and consistently capable of incompetence, it's the HSE. The difficulty here is that, from what I understand of this announcement, all of the redundancies have to be voluntary. Nobody is going to be fired. Now, that's presumably the Labour Party doffing the cap to the trade union movement, as usual.
It's Croke Park agreement, actually. They can't can't get rid of people that way.
Yeah, you see. So this is the problem with the HSE. You can't actually fire anyone if they're incompetent, and that's been the culture that exists in that organisation. So effectively you reward inefficiency. When they tried a voluntary redundancy package, you probably remember about was it 2 or 3 years ago there was a lot, most of the HSE administrators didn't take it up. They were hoping, I think, to get, was it 4,000 or 5,000 redundancies, and they got, 1,500 or something. So, I really can't see it working because, let's face it, HSE administrators are very well paid. They've cushy pensionable job. They've no responsibility if things go wrong, and they're very much protected. Why would they give that up in a deteriorating economy? They won't give it up. They'll just stay exactly where they are. So until we get to a situation where we have compulsory redundancies in a gloriously overstaffed administrative service, then we're not really going to get anywhere with the HSE, I'm afraid.
OK. Dr. Rory Hanley, GP and columnist with the Irish Medical Times. Thanks for talking to us today, Dr. Hanley.
Thank you, Jonathan.